Hi guys, so today we're gonna talk about chapter 6 from the family medicine textbook. So it's about well adult care. So using the RICE framework, like what we've done in the past, let's discuss the well adult care. So R is for risk factors. So starting with risk factors, we need to be aware of the major causes of mortality and morbidity in adults. So just to define the terms, mortality I think of it as synonymous to death. So mortality rate means like the number of people who die from a particular disease or condition. Whereas morbidity, I think of it as synonymous to like disease or illness. So it's like the number of people affected or unhealthy or is suffering or symptomatic for a particular disease or condition. So from our textbook, there's like a table and it shows us like the main causes of death in specific adult populations. So I'm just gonna read some of them out from my notes. So in the US population for all races, the main causes of death for people who are between the ages of 25 and 44 include, this is like in order. So the number one is the main cause, or the most frequent cause, and then number 10 is like the least frequent, okay? So it's the top 10 most frequent causes basically, starting with the most frequent one. So for the ages of 25 and 44, we have firstly unintentional injuries, 2 malignant neoplasms or cancer, 3 cardiovascular diseases, 4 suicide, 5 homicide, 6 HIV, 7 chronic liver disease, 8 cerebrovascular disease, 9 diabetes, 10 septicemia. I'm going to continue reading for ages 45 and 64 for all races in the US population. So number 1, malignant neoplasms or cancer. Number 2, cardiovascular diseases. Number 3, unintentional injuries. So as you can see, the first 3 are similar. They're just now in different orders. So for ages 25 to 44, unintentional injuries were the first causes of death, followed by cancer and then cardiovascular diseases. But ages 45 to 64, now we have cancer at the very top, followed by cardiovascular diseases and then unintentional injuries. So they've just swapped places. And then we have diabetes, chronic lower respiratory diseases, cerebrovascular disease, chronic liver disease, suicide, nephritis, septicemia. Age over 65 for all races. Number 1, cardiovascular diseases. Number 2, malignant neoplasms. Number 3, cerebrovascular disease. So now you can see here, cardiovascular diseases has moved up to the top leading cause of death, followed by cancers, and then cerebrovascular disease, and then chronic lower respiratory diseases, Alzheimer's, diabetes, influenza, nephritis, unintentional injuries, septicemia. So basically the pattern here is that as people get older, the most frequent causes become cardiovascular diseases, followed by cancer, whereas when they're a bit younger, unintentional injuries come first, followed by cancer and then cardiovascular diseases. So the top 3 are kind of similar. Also, as part of a risk assessment, we need to assess certain behaviors that may be linked to death or that may cause death. So firstly, we have obviously tobacco use or smoking, and then poor diet, physical inactivity, excessive alcohol consumption, illicit drug use, motor vehicle accidents, especially if they're driving when they're drunk or not using appropriate like safety stuff like having seat belts on, not using their phones while driving. Those are risky behaviors. Sexual behaviors, and the inappropriate or unsafe use and storage of firearms. So moving on to I, which is immunizations and chemoprophylaxis. For immunizations, we need to obviously keep an up-to-date record of the adult's immunization history and records. So some of the vaccinations or immunizations that may be indicated for an adult include Tdap or TD. So Tdap is for tetanus, diphtheria, and pertussis, which is whooping cough. So this is indicated for all adults. So Tdap is indicated for adults ages 18 to 65. And if they're over 65, usually just the TD is indicated, which is just for tetanus and diphtheria. So in terms of dosing, we give 2 doses, at least 4 weeks apart, and then we give the third dose 6 to 12 months after the second dose. And booster is every 10 years. So obviously we don't give this if there's been a record of like hypersensitivity to the vaccine. The next vaccine is MMR. So this is for measles, mumps, and rubella. So in terms of indications, so this is indicated for healthcare workers, travelers to foreign countries, people with HIV but not severely immunosuppressed, and like college or university students. So in terms of dosing, we give 1 dose initially, and then a second dose is recommended for those who work in hospitals, for those who are entering university or college, and those who are traveling to a foreign country. So measles and rubella vaccination, they have different indications, but we give them as one vaccine in the form of MMR unless contraindicated for whatever reason. So the measles vaccine is indicated if there's recent exposure. Rubella is indicated to women of childbearing age who lack laboratory evidence of immunity. But we do not give MMR to pregnant ladies. It's contraindicated for pregnant ladies. The next one is varicella vaccine, which is for chicken pox. So this is indicated if there isn't a reliable history or there's like a lack of laboratory evidence of immunity to chicken pox. Also, we give this to people who are high risk and susceptible to getting this disease. In terms of dosing, we give 2 doses 4 to 8 weeks apart. And varicella vaccine is contraindicated in people with active TB, people who are pregnant, and people who are immunosuppressed. The next one is the polio vaccine. So there's 2 types of polio vaccine. So the first one is IPV. So this is the inactivated version. And there's the OPV, which is the oral polio vaccine, and this contains live vaccines. So the routine vaccination against polio is actually not necessary. We only give these to like travelers who are traveling to a country where polio is endemic. We give them to lab workers who are handling this virus or studying this virus. We give these to healthcare workers who are at risk of exposure. So in terms of dosing, the primary series is 3 doses, and some travelers may consider having a booster if their primary series is complete. The next one is influenza, including H1N1. So this is indicated for everyone as long as they are over the age of 6 months old, particularly in high-risk individuals. So for instance, residents of a care home or like an institution, healthcare workers, like in pregnancy during the 2nd and 3rd trimester, people with chronic illnesses, and people who have close contacts with high-risk groups. So we give this every year, each fall or each autumn, and this is contraindicated if there's any history of anaphylaxis and acute febrile illness. The next one is PPV vaccine, which is protection against pneumococcal bacteria. So this vaccine is indicated for patients who are over the age of 65, and to those who have like chronic illnesses, cigarette smokers, and like residential home like patients or like institutional residents. So in terms of dosing, we give 1 dose after the age of 65, and we consider 5-year booster if they are at the highest risk. And in terms of special considerations, we give this 2 weeks prior to an elective splenectomy, and if like the patient's vaccination status is unknown. The next one is hepatitis A vaccine. So this is given if someone is traveling to an area where hepatitis A is endemic. It's given to people with chronic liver disease, lab workers who are at risk of exposure, men who have sex with men, and illegal drug users. So in terms of dosing, we give 2 doses, 6 to 12 months apart. The next one is hepatitis B. So Hep B vaccine is indicated for healthcare workers because of that increased risk of blood exposure. They're indicated to people who are having hemodialysis and patients who are receiving clotting factors. They're also indicated for people who have like household or sex contact with a patient infected with HBV, indicated for like IV drug users, men who have sex with men, multiple sexual partners, a recent STD, prison inmates, and any unvaccinated adolescents. So in terms of dosing, there's 3 doses in total. So the second dose is given 1 to 2 months after the first dose, and the third dose is given 4 to 6 months after the first dose. So Hep B vaccine is safe to give in pregnancy, so to give in pregnant women, but the baby still needs to be vaccinated against Hep B because the antibodies are not transmitted from the mother to the baby. The next one is the zoster vaccine. So this is protection against herpes zoster, which causes shingles. So this is indicated for anyone over the age of 60. So in terms of dosing, there's only like 1 single dose. So that's easy to remember. And then in terms of like contraindications, so this is contraindicated if the patient has like anaphylactic history again to gelatin, if the patient is immunodeficient, so in patients who have AIDS, leukemia, or lymphoma, patients with active untreated TB, and patients who may be pregnant. The last one is the HPV vaccine, which is indicated for any female between the ages of 11 and 16. And for those with prior history of like abnormal pap smear and genital warts. So this is actually a recommended routine vaccination for like ages 11 and 12, but it can be started earlier at the age of 9. And there's 3 doses to this vaccine. So the second one is given 2 months after the first, and the third one is given 6 months after the first. And this is contraindicated in pregnancy. Just additional information about immunization. So travel poses additional risks, and therefore travelers must know the local health risk in that area where they're traveling to and get the appropriate immunizations. So the main preventive targets include like foodborne and waterborne illnesses like traveler's diarrhea, Hep A, cholera, typhoid fever, as well as insect-borne diseases like malaria, dengue, and yellow fever. In terms of chemoprophylaxis, the USPSTF recommends the prophylactic use of aspirin for those patients or people who are at high risk of getting coronary artery disease. However, they are against the use of aspirin prophylactically to prevent colorectal cancer in those patients who are at high risk. Also, they concluded that there's not enough evidence for the use of vitamin A, E, C, and multivitamins for the prevention of cancers. Moving on to S, which stands for screening in the RISE framework. In screening, the screening tests are based on guidelines and recommendations. So, like level A and B recommendation means that there's sufficient evidence for the recommendation, and therefore it should be recommended and therefore like provided to the patient. Level C recommendation means that it shouldn't be offered routinely. Only offer it to like high-risk individuals, for example, if they have a strong family history or if the patient has strong personal concern. Level D recommendation means that that service shouldn't be offered as a preventative service because there's a moderate to high risk that the harms outweigh the benefits. Recommendation with level I means that there is just insufficient evidence to weigh the benefits against the harms. Also, with screening tests, there is a need for a discussion about the clinical considerations and the rationale for these tests with the patients to ensure that they understand the balance between the benefits and the harms. Just to give you an example of a level A recommendation for screening tests. So for instance, we have colorectal cancer screening. So this is level A, but there are different methods of testing or screening for colorectal cancer. So one of the methods is the fecal occult blood test. So the fecal occult blood test is the least expensive and the least invasive of all the methods, and therefore it poses the least risk. But it also has the highest rates of false positives. The other methods include flexible sigmoidoscopy and colonoscopy, which are comparable in specificity, but the colonoscopy remains the most sensitive test for detecting colon cancer. But again, it is the most expensive of all, and it is the most invasive of all the methods, and therefore poses the highest risk, like intestinal bleeding, intestinal perforation, irritation of the colon, and adverse effects from the sedatives. Here's some examples of screening tests that have a level B recommendation include screening for diabetes in patients with sustained blood pressure higher than 135/80. But there's insufficient evidence to screen for diabetes in all asymptomatic adults. Also, screening for depression in the general population has a level B recommendation. So for depression, we use questionnaires like the PHQ-2, and if the patients respond positively to that, then they could complete a much longer questionnaire called the PHQ-9 to help identify any depressive disorders. And just to give you an example of a level C recommendation, so the recommendation to screen for breast cancer between the ages of 40 and 49 has a level C recommendation. So we no longer routinely use mammography to screen for breast cancer in women who are ages 40 to 49. And basically, the screening for breast cancer, if the woman is less than 50, should be individualized. It should be based on factors like their risk, the benefits, the harms, and the values of the patients. Because there's a lot more like false positives in this age group, 40 to 49, and therefore this can cause like psychological harm and long-term worry in case of a false positive result. The last part is for education. So some of the most relevant topics that family physicians need to counsel their patients about is smoking cessation. Also educating them about alcohol and drug abuse. So in terms of alcohol, we can use the CAGE questionnaire to screen for harmful drinking behaviors. If they are pregnant, we tell them that they need to limit alcohol intake, and best if they abstain from alcohol, if they avoid alcohol completely. We need to educate them about, drunk driving. Also, if they are drug abusers, we need to refer them to the appropriate services to get treatment and counseling. We also need to educate them about the importance of oral hygiene and dental hygiene. So we need to remind them to go to the dentists regularly, to brush their teeth daily, to floss daily, and to use toothpaste with fluoride. Also, we need to advise them on unintentional injury prevention. So, wearing their helmets when they're riding a motorbike or their bicycles, and wearing seat belts whenever they're in a car. Educate them about fire safety. We need to educate them about domestic violence prevention. So we have the SAFE questionnaire to screen for potential domestic violence. If we suspect that there's domestic violence, obviously we need to point them to the relevant community services. So we need to counsel them regarding the available shelters, childcare, and other legal services. The other one is counseling them on healthy habits, healthy eating habits, like nutrition. So we need to screen for obesity, and we need to educate them about maintaining a healthy lifestyle by exercising enough, not eating in excess, maintaining, a healthy and clean diet. In terms of physical activity, we need to tell them that the recommendation is at least 30 minutes of moderate intensity exercise on most days of the week. We also need to educate them about STDs, HIV, and unintentional pregnancies. So all adults that are high risk should be counseled about STDs, and we need to counsel them regarding contraceptive measures, how to avoid, or just the importance of avoiding high risk sexual behaviors and avoidance of high risk partners. And finally, we need to educate them about just skin protection, so avoiding excessive sun exposure, wearing appropriate clothing, and applying sunscreen whenever necessary.